Resolving healthcare inequities is necessary to improve care, patient outcomes, and population health. In 2021, the Institute of Medicine identified 6 key domains as being essential drivers of improvement in healthcare quality. Equity, in fact, is one of those domains, but has been considered the forgotten domain as it is often not the focus in quality improvement efforts. In more recent years, equity has been increasingly prioritized by national organizations and accrediting bodies. However, how local hospitals and frontline clinicians are prioritizing equity and ensuring quality efforts are meeting the needs of diverse groups of patients remain unclear. The aim of this study was to evaluate frontline equity efforts and the structures and processes in place to support health equity at hospitals participating in ACS quality programs. This was an exploratory mixed method study consisting of online surveys and virtual interviews of hospital quality program leadership experiences with local equity efforts. 44 quality programs were recruited to take the survey, 36% of them completed the survey, and 5 sites were identified for one-on-one semi-structured interviews. From our surveys and interviews, we found that efforts were implemented mostly at the institutional level, which meant that in many cases, they often lacked the granularity needed to address the specific needs of individual programs. Themes that emerged were grouped into barriers and facilitators. Barriers included lack of preemptive structure and unclear roles, lack of access to knowledge or training, lack of prioritization of health equity efforts, lack of data to define specific needs and targets for groups experiencing disparities, and state-level restrictions on DEI. Facilitators included strategic plans with goals and objectives, leadership and staff buy-in, and having dedicated resources specific to equity efforts available. In general, all sites had some efforts aimed at addressing health equity, but there was a lack of clear structures, processes, and roles to support effective efforts leading to unwarranted practice variation. Important opportunities that could be intervened upon were identified in our data, and these opportunities must be addressed to achieve health equity and ultimately resolve disparities in healthcare access and outcomes.